Hi, my name's Jane Lynch. I'm one of the training programme directors for the scientific training programme, and I'm a cardiac clinical scientist by background. I work with the National School for Healthcare Science, and I want to talk to you a little bit today about the scientist training programme. So first of all, before we get to the programme, we need to just discuss a little bit about what healthcare scientists are, what do they do, how do I become a healthcare scientist, and then we'll get on to the scientist training programme. So healthcare scientists make up approximately 60,000 people within the NHS, and they work across 50 different specialisms. And that's about 5% of the NHS total workforce. They work mostly in the acute sector. More than 90% of them work in diagnostics, and healthcare science staff affect most patient pathways and inform more than 80% of all clinical decisions in primary, secondary and tertiary care. They do this by helping to prevent, diagnose and treat illness using their knowledge of science. And certainly over the last couple of years, during the COVID-19 pandemic, healthcare scientists have been very much in the news. They've received great media coverage for development of vaccines, development and delivering PCR and all other testing platforms. So our clinical engineers have been really important in terms of getting the appropriate equipment into ICUs to support the treatment that we give to our patients, particularly with ventilators and other pieces of equipment. And scientists and science has been critical in ICUs in terms of respiratory, cardiac and critical care. Scientists helping to provide appropriate care in such a massive surge of need for care. They've been really useful to help out with all the other different professions that are working there in a really multidisciplinary way. So what do healthcare scientists actually do? There are four big groups of healthcare scientists. We can break them down into life sciences, and these are people who tend to work in laboratories such as hematology and transfusion laboratories, microbiology, histopathology and lots of others. Physiological sciences, which include cardiac science, neurophysiology, gastrointestinal physiology, audiology, and a few others. Medical physics and clinical engineering, and this includes groups such as those that work in radiation protection and monitoring, biomedical engineers, people who work in MRI and other forms of medical physics. And groups that work in bioinformatics. So these are people who work in computing to do with genomics, health informatics and physical sciences. Lots more information about this is available on the NHS Health Careers website, and I've put a link just there at the bottom of the slide. So to start off with the life sciences, these are people who work in advanced laboratory diagnostics. So the healthcare scientists working here are mainly based in laboratories. They include a group that work with genomics. Genomics is a really interesting field that's gathering momentum at the moment. And within healthcare science, we have life science healthcare scientists who actually do genomic diagnosis. So they can look at the genetic makeup of any individual to find out a lot more about what's going on. They can understand if any of those genetic markers are slightly abnormal. They can give us a lot of information which can predict the course of illness, and it can also allow us to treat them in a most beneficial way. Microbiology has been really important over the last year through COVID. On the left here, you can see the virus itself, a nasty little thing that's caused all sorts of problems for us. But microbiology is the area where they'll test for this particular virus, and they've stepped up to the mark magnificently, all our microbiologists and virologists, coming up with new tests, rolling those out, quality assuring them and making sure that the diagnosis within the NHS labs has been fantastic over the last year. In medical physics, we have lots of healthcare scientists working in this area. Some of these medical physics healthcare scientists will have direct patient contact, but we also have a lot who work behind the scenes, working with these incredibly expensive, complex pieces of equipment to make sure that they can get the best treatment for patients, the best way of diagnosing illnesses by looking at the science behind how these machines work, optimizing them to make them as safe as possible they can for patient treatment. And as I said earlier, we have a lot of clinical engineers who are in equipment management, and they've shown their true colours over the last couple of years. They've imported lots of new equipment when it was needed at a time that we just didn't have enough equipment. They've managed to make sure that that all works. They've kept it up to date. They've made sure that people understand the instructions for it, because a lot of this equipment came from overseas and wasn't necessarily in English. And they're rolling out lots of training programs to ensure that our healthcare scientists are teaching all the different people who use these machines how to use them optimally. The physiological sciences, the healthcare scientists mainly work with patients, and they measure and they monitor particular conditions. So in audiology, this would be to do with hearing and balance. In the cardiac sciences, which is my background, we work with people's hearts. We monitor them. Sorry, we monitor and diagnose cardiac problems. This here is an echo. This is cardiac, one of the forms of cardiac science that we offer on the STP. And here we use ultrasound to have a look at the patient's heart. We can see if there are problems with the valves. We can see if there are problems with the muscle. We can see lots of things about the patient. We can also use it for screening. So we do this for a lot of young people to make sure that any inherited conditions are not present. And we can tell a lot from just doing an echo about what's going on with the patient's heart. And we can then advise treatment if it's necessary, or we can reassure the patient that it's normal. Another area of physiological science is respiratory and sleep science. And again, this was really important during COVID, because a lot of patients who weren't quite ill enough to go on a ventilator benefited massively from a form of non-invasive ventilation. This is an example of CPAP, which is continuous positive airways pressure. And basically what this does, it blows pressure into the patient's airway to keep it open, and that allows a lot more oxygen to be delivered to the patient so that they can breathe much more easily. This has generally been a treatment for sleep apnea in the past, but it's proved incredibly important during COVID to take the pressure off the intensive care units by keeping the patients well enough not to need that kind of high-level treatment. Clinical bioinformatics is a way that healthcare scientists can ensure that any data received and generated by any laboratory is used in an efficient, standardised, secure and accurate manner. So basically they take all the data that's produced by a department and they can run programs on it to find out how prevalent a certain condition is in the general population, or they can look at the genomics data that comes through from patients, and they can optimize the patient's treatment by looking at it in a much more computerized, big data kind of way. So healthcare scientists are a hugely diverse and a highly skilled workforce, and they work with leading edge technologies to provide the best treatment for patients. One of the things that we've seen over the last 20 years or so is a massive change in healthcare, and the genomics revolution is one of the examples that we have of this. So if you think about the mobile phone, now most of you probably haven't seen the one on the far left here, but when I first saw a mobile phone, it looked a bit like the one on the left. It was a huge brick thing that didn't really do much other than make phone calls. It needed to be very close to its base to allow you to get a signal. It was nowhere near as clever as the ones we've got today, but through a number of updates, new generations, lots of technology, you can see that mobile phones have progressed from being just something to make a telephone call with to something that can really run your life. It's a mini computer that you hold in your hand and that you expect to get a signal wherever you go, and they're completely life-changing, and that's not that long that this evolution has happened. And the same thing's happening for genomics. Over the last few years, we have not only learned how to do genomic testing on a much larger scale, but we've also brought down the cost of it. So where a mobile phone would have cost a lot of money in the old days just to have one that did phone calls only, and nowadays we can have one that's affordable to all, that is a mini computer. Genomics is the same. We can do it much, much more cheaply because we've got the capacity and we've got the technology available to do that now. So what we're looking for in the future in healthcare is a big shift towards personalised medicine. So this would be looking at the person rather than the illness. So the way that we treat illness traditionally is to look at what the symptoms are, work out what the illness is, and treat those symptoms. And if you can treat the illness itself, that's a bonus, but really we're looking at just that, what we know about that particular illness and how to deal with it. What we will be able to do in the future is to have much more personalised medicine, because we will understand much more about the person. We'll be able to look at the genomics that they have. We'll be able to look at their economic, social and population data. We can look at other tests that we've done on them. We can put all these things together, and we can actually understand much more about the disease process of that disease within this individual, because we know that the genetic and the economic and social data that we've got about that patient will tell us more about how it's likely to progress within that person themselves, rather than giving them treatment that's useful for a big population. We'll be able to tailor it just to them. So this is an example of what I mean by that. And this is 5 babies that have all been born, and they have the same symptoms. They're displaying a problem with their insulin regulation of the blood sugars. But if we can look closer at each of these babies, if we can look at their genomics, we can see that all of them have got a different gene that's the problem for them. So there's a lot of figures there, but basically that's telling you that each of these babies has got a different genomic problem, which has given them a different disease process, and therefore all of them need a different type of treatment to optimize their development. So those treatments might be very different, but because we understand what the underlying problem is, we can tailor their management much more effectively so that they will grow up much more healthy. And the other thing to think about healthcare in the NHS is that we are the single biggest integrated healthcare system in the world. So the potential for new developments is massive in the NHS. If we can combine with our world-leading science-based and global reputation for innovation, we've got the opportunity and the capability to transform the way we deliver healthcare to secure benefits for our patients, our society, and also our economy. This is an example of how we can not only benefit the patient, but we can save money in quite a big degree. So pressure ulcers in the NHS is a big problem. It's miserable for the patient, it creates a lot of knock-on effects, and it costs a lot of money to look after those patients and to treat the pressure ulcers. So what we really want to do is to reduce the occurrence of pressure ulcers in the first place, because that's going to benefit our patients and it's going to benefit the economy. And our clever clinical engineers can do a process called pressure mapping. By using different computing systems and sensors, they can look at the way that patients are sitting in their wheelchairs or lying in their beds, and they can look at the areas that are getting the most pressure points, and then using that computerized mapping, they can come up with solutions to look after the patients better, to provide more support in the danger areas, and they can then train the nurses and the patients to treat patients and to help them to lie differently and to use different equipment to make sure that pressure ulcers don't develop in the first place. So how do you become a healthcare scientist? There are various routes into becoming a healthcare scientist depending on your entry level. So we have T-levels, which is a 2-year qualification including a 45-day industry placement. We have apprenticeships, which are full-time employment positions, which are combined with classroom learning. So you go and work in a department and you go to university part-time to get the classroom learning, and that's all together, but you are based with an employer. At the same time as that, we have something called a practitioner program, which is a 3-year degree where you're based at the university, but you have placements within the department. So it's the same kind of program that you're doing, you just do it in a slightly different employment way. Then we have the scientist training program, which is what I'm really here to talk to you about today. That's a 3-year MSc Honours undergraduate training program. And then as you progress through your career, you might also want to go onto the higher specialist scientist training scheme, which is a bespoke 5-year PhD level training program, which equips our scientists to become consultant clinical scientists at the end of it. This is our career and training pathway for the healthcare science workforce, and basically all this is doing is showing that we can enter the profession at a band 2 and go through various apprenticeships. You can do level 2 and level 4 diplomas. You can then go across into the practitioner training program, or you can enter the NHS at that point. So you can come in sideways through equivalence, or you can come direct entry. And again, that moves to the next level where we've got the scientist training program. You can do that through equivalence progression, or you can come in through the graduate direct entry or in service training program. And then from there, you can go on towards higher specialist scientist training, or you could go into clinical academic careers. There's a lot of progression with healthcare scientists, lots of opportunities there for you to keep learning throughout your many years in the NHS. So the scientific training programme is a full-time 3-year programme which is commissioned by HEE. So your salary and your university fees are funded. So you get paid at a band 6 level and you go to university for your Masters in Science. It's part-time, it's fully funded, and you get the academic teaching and assessment through an HEI. And at the same time, you're based in the workplace. You have an employer who will be a department that provides healthcare science roles, and they'll give you lots of practical hands-on training in your specific role as a healthcare scientist that maps to the university learning that you're doing at the same time. So at the end of it, you come out really useful, really able to do a fantastic job. And this is a highly competitive programme. We get around 300 to 400 places annually that are funded by Health Education England, and we get about 7,000 people applying for them. So it is competitive, but it's a really, really good programme to get onto. The school, I work for the school, the National School of Healthcare Science, and this works in partnership with universities, training providers, commissioning leads and the professional bodies to train scientists that will be leaders in healthcare, understanding and advising on the most recent advances in technology and innovations in patient care. So we safeguard the delivery and quality of education and training for healthcare science nationally, and we support the trainee and help to manage the programme over the 3 years. And we are part of Health Education England. The STP has a number of aims. The first and most important is to get our healthcare scientists to be in a position to apply for statutory professional registration. And this is a really important thing because it's a way of protecting patients and the workforce and ensuring that the appropriate standards are met for all the people who hold statutory professional registration. And this is through the HCPC, the Healthcare Professions Council, which regulates the standards of healthcare scientists. We want our trainees to be involved in world-class performance in clinical science. We'll do that by giving them the appropriate level of underpinning scientific knowledge. Trainees will become competent in undertaking complex scientific and clinical roles. They'll be able to define and choose investigative and clinical options. They'll make key judgments about complex facts and clinical situations within a quality assurance framework, again, ensuring those standards and safety are there. Many trainees will work directly with patients, and all our trainees will have a positive impact on patient care and outcomes. And graduates will be involved, often in lead roles, in innovation and service improvement, research and development. In the first year of the STP, you'll go to university and do some broad introductory modules across your theme. And in the workplace, you'll do the workplace induction so that you know what the standards and the clinical aspirations of your workplace are. You'll do some rotational placements, and these are an opportunity for trainees to see a little bit outside their own specialism. So they'll go to quite closely related specialisms within their own trust. They'll make connections, they'll understand a little bit more about the patient pathway, and they'll understand their position in the wider trust a little bit better. And there'll be some modules that they'll need to complete, which are listed in our curriculum library. After the first year, trainees will do much more specialist teaching, including their research project. This is a master's programme, so they'll be expected to do a master's level research project as part of it. They'll do much more specialist training and be largely based in their home or host department, although this could be delivered across a consortia of departments where the training will rotate around a few different departments that can offer them the best training in their area. And trainees will take part in the midterm review of progression, which is just an independent evaluation of progress, and it allows us to pick up trainees that might be struggling a little bit so that we can give them some extra support to make sure that they're best placed to go into the final year of their programme. In the final year, the trainee will complete the Masters. They'll also complete their e-portfolio of work-based assessment. They'll pass their final assessment, and if they complete all of 3 of these, they get their certificate of completion of the programme, which allows them to take this to the HCPC to become statutory registered. And as I say here, it's the HCPC that is the regulatory body, and they become a registered clinical scientist after completing the programme. So again, just to break down some of the different areas that we have 4 main areas that we offer the STP in, and the first of these is life sciences. And you can see within that there are lots of different specialisms available within that look at biochemistry, microbiology, embryology, histopathology, genetics, or as it's called here, genomics, genomic counselling, lots of different areas that you can qualify in life sciences, depending on what your preferred area might be. Physiological sciences is broken down into 2, CVRS, which is cardiac, vascular, respiratory and sleep. We also have gastrointestinal physiology, urodynamic science and critical care science in that group. And then the neurosensory sciences, which are audiology, neurophysiology and ophthalmic and vision science. In the physical sciences, we have quite a few areas within medical physics. There's imaging with ionising radiation. There's imaging with non-ionising radiation. Those are 2 different areas looking at the really complex testing and monitoring and optimizing of those machines. There's radiotherapy physics and radiation safety physics, which look at ensuring that patients are safe whilst we provide them with diagnostics and treatment. Clinical pharmaceutical sciences, which is more about producing different kinds of radioisotope markers and drugs that need to be done in a specific way and in specific conditions, including sterile conditions. And there's reconstructive science, which is more to do with the teeth and the jaw, that kind of thing. Clinical engineering is divided into 3 groups, which is rehabilitation engineering, and that's looking at the aids that we give to patients to make them more able to move around and to carry on with their lives as normal. Clinical measurement and development, and device risk management governance, which is looking at the kind of equipment that's there and making sure it's always available to and in the right kind of quality assurance that we have that the devices are working appropriately. Informatics is split into 3 different areas. So there's clinical bioinformatics genomics, which is looking at making sense of that genomic information that we found out from the life scientists who are actually performing the tests on that. There's clinical bioinformatics, health informatics, which is looking at a much more widespread use of health data. And clinical bioinformatics physical sciences, which looks at more the physical equipment and managing that and getting information from some of the diagnostic tests that we use. The entry requirements is a first or a 2-1 in a relevant undergraduate honours degree or integrated masters. And for a list of the relevant undergraduate honours degrees, you can look on our website, and that splits in the different divisions that we have and what kind of undergraduate honours degree we would want for each of those. A 2-2 is also accepted if you have a higher degree in a relevant subject. So if you have a master's already in your relevant subject, we wouldn't be necessarily asking for a first or a 2-1. A 2-2 would be okay. We want to know that you are able to do research. So if you've got some evidence of research, that's very desirable. And experience working in a caring role is really important in some roles. So for roles like genomic counselling or cardiac science, if you can demonstrate some evidence that you've worked in a caring role, that's going to be quite beneficial if you put in an application. And also, as a trainee, you need to be able to meet the travel requirements of the training role and the clinical placements. So you will be needing to be available to go to university, and a lot of our universities do blocks of training, so it might be 6 weeks at a time, it might be 1 week at a time. Some of them do day release, and over the COVID pandemic, a lot of it's been online, but you would need to be able to go to university to take up the academic teaching, and also you might need to travel between different trusts to get your clinical placements done. This is just an example of the STP person spec, which again is available on our website, and that's updated every year. So if you did want to apply for the STP, it's worth looking closer to the time and making sure that you're aware of what the person spec is so that you can demonstrate to us that you have all these skills. We've talked to quite a lot of trainees and asked them what makes a successful candidate. So what did they do that got them an opportunity on the programme? And really what we would be looking for is somebody who understands the role of a healthcare scientist. We want them to be enthusiastic, patient-centred. They need to be academically motivated, and they need to be interested in research. So our trainees tell us that some of the ways that they've got that information is to look at podcasts and journals, to look at the NHS Constitution, to think about what transferable skills they've got. So if you haven't got any particular caring experience, but you spent some time working perhaps in a cafe, think about what it is that you enjoyed by working with people, and think about how that can be a transferable skill if you were trying to demonstrate how well you work with people. What are your communication skills, perhaps? Did you enjoy that kind of work? We also ask people to gain experience where possible. That's been more difficult over the last couple of years, but a lot of schools will offer work experience trips for their trainees to go to laboratories, or you could try gaining that direct with the laboratory if you want to engage with them. Some of them will have STP open days where they'll show you what happens in their department. That's a really good thing to do, to go along and actually see what's happening there so that you know that you really are interested in it. Prospects after the STP. Well, we always do an exit assessment on all of our trainees. We ask them to fill in a survey to tell us where they've gone afterwards. And we usually get about 2/3 of our graduating trainees filling this in. So this is just an example of the career destinations that our 2020 completers had a couple of weeks after they graduated. So this is very quickly after they complete the course, and this is information from about 2/3 of those who completed the programme. But as you can see, most of them were employed as a clinical scientist in the NHS. Some of them went into roles outside of the NHS or in another HCS role within the NHS. There were still a few that didn't have a job at that point, but it was a very small proportion. So we usually get well above 90% of our trainees actively employed in as a clinical scientist very quickly after they come out of the programme. This was the 2019 trainee career destinations. So here you can see again that most of them were employed as a clinical scientist in the NHS, with a few more employed in other roles within the NHS, but the vast majority, as you can see, had gained employment in the area they wanted to work. So 78% response rate for the 2019 STP Exit Survey, which was a really good response rate, and it was fairly evenly distributed between life sciences, physiological sciences, and we put the physical sciences and informatics together. The informatics sciences is very small, so it doesn't easily lend itself to a separate group there. But as you can see there, that we got quite a wide range of people responding to the exit survey. We asked them within this survey what were their top 5 factors in applying for the programme. Number 1 was the opportunity to gain registration as a clinical scientist. Also cited were opportunity to work in the NHS, interested in a career in healthcare science, the quality of the training programme, and the blend of workplace and academic learning. We asked them about their experience of programme, and 92% agreed that they were pleased that they took part in the training programme. There were a few people who weren't very happy with it, but we still think 92% is a really good response rate of who was happy with it. And there were some comments here about what they thought wasn't quite so good or what was really good about it. They were happy with the MSc. They were really pleased that it was funded and it was an excellent opportunity for career progression, and they had some excellent opportunities as part of the course. So for more information on any of the points that I've described here, you can have a look at our website. It's newly developed and it's fantastic at the moment. It's much easier to search for what you want to know. If you go into the main landing page here and click on programs, you'll quite quickly go to the STP, but you can also have a look around at all the other things that we do, which are quite interesting and might give you some ideas for the future.